Think about this. Almost 2 billion children around the world lack access to surgical care and are 14 times more likely to die before the age of 5 than kids from developed countries. When I co-founded Operation Airway in 2007, our goal then was to teach complex pediatric surgery in Latin America and help build surgical airway programs. Then, in 2017, I laid eyes on a young patient who wasn't even one of ours, and everything changed for us. This tube is the size of the tube that you and I would use. It was a 6.0 endo tube. The child's wide awake, so he's not sedated, and he's in 4-point restraints. This child pulled the tube out that next day and died. That night, Operation Airway became CareWays Collaborative. The question becomes, how often do such children die? Why do they die? And what can we do about it? We needed to count mortalities, design an intervention plan, and then count again to see if we made a difference. We already established that there were simple and cost-effective solutions which can have a significant positive downstream effect. We knew we could offer physical resources like correct-sized breathing tubes. But the most important resource we had were the human resources, the healthcare providers that struggled daily to care for these children. This is where the collaborative in CareWays Collaborative comes in. Our biggest asset turned out to be the people who were already there. We met so many smart and dedicated doctors and nurses who wanted to do better for themselves and for the children in their care. Imagine how it would feel to work in an ICU where almost a quarter of your young patients aren't going to survive. For every country we have worked in, our first order of business was to listen and learn, and above all, to build trust.
Estamos muy emocionados aquí en el Hospital de Niños Benjamin Bloom de parte de la Unidad de Cuidados Intensivos en que esta jornada nos acompañe debido a que nos traen tecnología, nos traen aprendizaje, nos traen práctica y eso eleva la calidad de atención de nuestros pacientes pediátricos.
Este compromiso va más allá de las dificultades que podemos enfrentar a la hora de hacer los cambios. Esta dificultad para hacer los cambios es debida especialmente a la natural resistencia que la mayoría de seres humanos, porque lo interpretamos como una crítica negativa a nuestro trabajo y no como la certeza de que siempre hay alguna manera de mejorar.
Pero luego los enfermeros, los médicos nos dieron esa seguridad que nosotros necesitábamos, nos hicieron parte del equipo, que para nosotros es fundamental e importante.
Estoy de acuerdo y creo que eso también cambia nuestra perspectiva, cambia nuestra cultura hacia una mejor forma de ser, una cultura de servicio y sobre todo trabajo en equipo, que es, como decía el doctor, lo más importante.
Together with CareWays, very important to have this networking. We can share information, we can share cases, so this contact with one of the best teams in the world will change the lives of many children.
What we've learned is that we can build together low-cost quality improvement programs that identify and close educational gaps and break down silos of communication. It has clearly worked in El Salvador, and we now have a working and sustainable model. In the past 5 years, the mortality rate in the ICU there has gone from 24% to 6%. This became our collective goal, to build a system together, at once sustainable and scalable, that would allow children to safely go from the home, to the hospital, to the operating room, to the ICU, to the ward, and then home again. So to bring this to scale, we're focusing our efforts on 3 countries where we apply everything we have learned and then share these results so all those children can receive the care they so desperately need. And these countries will share what they've learned with our growing list of regional hospitals. The learning ripples outward. A hospital shouldn't be a final destination for any child. It should be a place that breathes new life into a long and healthy journey. So get involved, jump in, and become part of the solution.